President Trump signed others touching on health care reform and funding for abortions abroad. Here to unpack those executive orders and the bill that passed the House this week is the chairman of the House Budget Committee and a registered nurse, Tennessee Congresswoman DIANE BLACK. Welcome to the program.
You're welcome.
I want to start with Obamacare. Early on, Speaker Ryan and the President Trump, said there would be a simultaneous repeal and replace of Obamacare. Your Budget Committee is going to have a lot to say with how this ends up in the form it takes. Will we see a simultaneous repeal and replace?
I think what you will see is that we will replace pieces of it, one piece at a time. You're not going to have a big comprehensive bill, as was the Affordable Care Act.
Why not?
Obviously, that doesn't work. When you have a piece of legislation that is that large, it's just unwieldy. And that's really not the best way for the American people. So us doing it piece by piece, and what I want to be sure that people understand is we're not going to let people fall off the cliff, that we're going to have an opportunity to be able to bring a soft landing. The other thing is that all of this doesn't necessarily have to be done by legislation. Some of this can be done by hopefully Chairman Price, once he is confirmed, that he'll be able to do an HHS with his authority there. And if you read the Affordable Care Act, you will see how much the Secretary is really able to do, and it's quite a bit. So between the two working, we're going to get a better system that's more affordable, more choices.
Let's talk about all these plans swirling out there, and there are a number of them, including one that then Congressman Price put forward.
That's right.
You've got the American Health Care Reform Act. You've got Tom Price's Empowering Patients First Act. You've got the Patients' Choice Act. What pieces, those are three different plans. What do they have in common, and what do you think the final replace will look like? What will be the common or bullet points that we can expect to see?
So let's talk about the things that are the most onerous right now.
Okay.
And what's most onerous right now is the increase in premiums, the increase in deductibles. The president said if you like your plan, you can keep it. We know that a lot of people lost their plan. As a matter of fact, in the state of Tennessee, 28,000 people lost their plan in one day because it didn't meet all of the dictates of Obamacare. And so we want to look at those things that are hurting people the most, and that's what we want to deal with. And you can do that, as I say, in various ways, but you really have to get the real repeal piece in there so you can actually start giving some relief to people by putting new systems in that are patient-centered, that go out into the marketplace and actually allow the marketplace to work, to have some different products, not things the government says you need, but what do people say they need? What can they afford? That's what we want to do.
So certainly no mandates. Certainly health savings accounts will be encouraged.
That's one, yes.
What else? Medicaid block grants to the states, letting the states sort of take control of the health care for those beneath the poverty line or at poverty line or the working poor. Is that the vision?
That is one of the ideas that's there, and it's a very good idea because governors will tell you what works best in their state. As a matter of fact, our leadership sent a letter out, a survey out to governors all the way across the country and said, if you had the opportunity to change things, what would you do? What would you want? I had the opportunity to be with my governor this last weekend and ask him about how he filled the survey out. And I actually read his survey prior to meeting with him. And each state is different, and it would like to have the opportunity to be able to take care of the people in their state with patient-centered care to the best that they can provide for their
There is a plan that was unveiled in the Senate. And under this vision, this just happened this week, they would like to see the states take control of health care, but it would allow some of these Affordable Care Act models to stay in place. Would you favor that approach?
If the governor of that state decided that the pieces of the Affordable Care Act were working best for them and that's what they wanted, but remember, they're going to get an X number of dollars, and they will have to determine what's best for their state. And some governors may make that choice, and other governors may say, we want the competition in the free market.
During the appointed HHS Secretary's hearing, he hasn't been confirmed yet, but this is the Trump designee, Tom Price said he couldn't answer the question when he was asked if people would lose health care through this new plan. Is that a concern for you, that people might lose their care, and might they?
I think that I didn't hear what he had to say, so it's awfully difficult for me because I think there may have been some context around that that might make it better for me to understand what he was saying. But again, we are going to have a system that will put into place patient-centered care using the marketplace where there will be a lot of different products out there that people can use. Not just one product, but a myriad of products.
People will be able to
choose.
To shop across state borders.
Well, yeah, what works best for me? You know, my family may need something totally different. My family may be very healthy and an HSA works well for them. Or you may have another family that has a lot of healthcare needs and their plan is going to look a little different. I do want to point you to back in our State Farm Bureau, who is an association, so they didn't have to abide by all the regulations that were in the mandate. They now are being just flooded with people wanting to talk with them because they have affordable plans that meet the needs of what people are actually wanting. And they are having folks every day call them to say, we want your plan. We can afford it, and you have what we want.
This week, Congress did something we've never seen. They extended the Hyde Amendment. Now, tell, for viewers who don't understand, this was basically a rider to appropriation bills year after year after year after year.
Yes.
This is now a piece of independent law. What does this mean? What does it do that we didn't have in place before?
Well, the Hyde Amendment prohibits dollars being used for abortion, taxpayer dollars. And what would happen is every year they would put it as a rider on the appropriations bill in the labor HHS appropriations function. And what that did is it covered just what was in that particular function. It didn't cover all of federal government. And what this bill will do is it will actually cover all of federal government. And so it will also make it permanent because each year when you have to come back to pass this Hyde bill, Hyde Amendment, even though we've had good bipartisan support over the 40 years that this has been done, there's less and less of that happening. And so this gives us an assurance. It puts stability there, and it allows the taxpayers to know that their dollars are not going to be used for funding abortion.
What do you make of that, the passing of that bill? Now it goes to the Senate, of course, but I presume the president would sign this. In one of his first executive orders, he reinstated the Mexico City policy, which forbids any federal funds supporting organizations, non-governmental organizations that promote abortions or provide them abroad.
Abroad, that's right.
Given those two pieces, just in the first week, is this the most pro-life administration, Congress that you've seen or been a part of?
At least I've been a part of, and I don't know because I haven't been a part of a lot of other administrations, but I'm almost giddy by what we're able to do. As a matter of fact, people that are pro-life and pro-choice both agree that taxpayer dollars, 6 out of 10 people will agree that this is not the appropriate use of our tax dollars. And so this is something that, again, has been bipartisan, and I'm really delighted that we're able to get it to where we are today and hopefully get it to the president's desk so he will sign it.
One of the big controversies of the week, the president and his spokesman reaffirmed President Trump believes millions of undocumented people, illegal immigrants, voted in the last election. Do you share that belief?
I don't have the documentation to actually say, and so I'm always one of those folks that you got to show me. I'm not from the Missouri state, but I am a show me kind of girl. I do think that this needs to be looked at, and we hear cases that are anecdotal, but we don't really know for sure. And I do think that is something we have to be aware of, that we're only having people that are bona fide citizens that are electing our leaders. It's important.
Congresswoman Black, thank you so much for being here.
So
We hope
welcome.
you'll come back soon.
I'll do that.
Thank you.
Thank you.
Well, that is all the time we have until next week. The show continues on Facebook and Twitter. Like me on Facebook, follow me on Twitter. The links are at RaymondArroyo.com, as is our Will Wilder bookmark giveaway. And be sure to tune in next week. We'll take a closer look at the president's U.S. Supreme Court pick and much more. Until then, we'll be scouting the world over for all that is seen and unseen. On behalf of the staff and crew of EWTN News, thank you for watching. I'm Raymond Arroyo from Washington, D.C. Bye now.